listening to all this incredible information from this amazing group of women that after going through so much of this on a personal level my whole life, how much I still have to learn. And I thank all of you. I would like to just start with a little story because I think it's kind of indicative of how people feel about pain. I just finished a long drive to pick up and bring my daughter home from her first year in college. And I extended an invitation to her last night to come with me this morning. And she said, "What are you speaking about?" Like, what? Well, that's really odd. You don't go speak anywhere, you know? And I said, "Well, I'm actually going to speak about the chronic pain associated with all the disorders I've had over the years, and you'd have to dress up a little bit." And she said, "Mom, please, I've had a front row seat for years dealing with all the pain that's gone on in this household. And guess what? I got to wear my jammies." So thank you very much, but it's my first day home from college. No, thank you. And I sat there, and we had a good laugh, and I said, "Hey, I think this is what many people think about a discussion of pain, particularly chronic pain. So what do I think, having lived with it most of my life? I feel it is extremely important to speak out about it. And I say that because it is extremely difficult for women who have had it to speak out about it. My thoughts wander right now to the millions of women and men who would be in too much pain to even come here. Just the travel plans alone are daunting when your body hurts all over. And I also wonder, my thoughts wander especially to my mother, who is has suffered from most of her life undiagnosed endometriosis, and now with other health issues, very severe fibromyalgia in the later years of her life. But this is about my own personal story, and each person with pain has their own personal story. Endometriosis became my lifelong friend over 20 years ago, when one day I passed out in the middle of a sidewalk in downtown DC and just fainted. My gynecologist had been telling me for over a year that the severe pain that I had nothing to do with my efforts to conceive, and that there was absolutely nothing to worry about. Well, passing out on the street, getting hauled to the hospital, got his attention. I got in to see an expert and was diagnosed with very severe endometriosis and was in the operating table within a month. Thus began my life with endometriosis and subsequent 10 surgeries to control the disease, because none of the medications at the time helped me at all. They made me so much sicker and feel so much worse. During that time, I also found out, after being misdiagnosed by numerous doctors and not giving up, that I had fibromyalgia, TMJ, and irritable bowel syndrome. Later on, proper diagnosis, good doctors, more information and knowledge brought me osteoporosis and severe arthritis of the spine. And it's my personal belief that those are connected to all of this as well. My life then, along with the many other people that you've heard about here, has been spent managing these illnesses while trying to pursue a very, very wonderful professional career I had with the federal government, trying to stay married, which you can imagine is not an easy task given all of this, caring for my adopted daughter, who, since she was very young, suffers from depression and severe anxiety, and also for the past 10 years now, caring for my single sister-in-law, single-parent sister-in-law, who was unfortunately diagnosed at the age of 55 with Alzheimer's disease. I also have two sister-in-laws whom I love dearly, both of whom are currently and hopefully forever breast cancer survivors. So, I can tell you from firsthand experience, I have seen all kinds of pain. I have seen deep emotional pain, I've seen acute physical pain, I have seen, oh my gosh, you name it, and I've been there, and or I felt it and I've lived with it. Much pain, where's the relief? This is what I feel. Just because a disease does not kill you doesn't mean that the quality of your life, your work, your relationships with others is not affected in a most profound and long-lasting way. Endometriosis caused excruciating pain for me for up to 3 weeks out of the month. And it also meant that I was unable ever to have any birth children. I don't know which is worse going through all that, the pain in the body or the deep pain I experienced many years in my heart. Fibromyalgia also became a good friend of mine 25 years ago. For 2 years, I could not work and was unable to get out of bed until 3 or 4 o'clock in the afternoon. I always say, imagine a muscle strain in every muscle of your body times 10, or a vice grip on your muscles. IBS and TMJ, in my case, accompanied my fibromyalgia. And I always like to throw it at its worst, TMJ is like having rocks in your jaw, and IBS is like having your colon on a permanent roller coaster. Despite this, and perhaps because of how lucky I feel in so many other ways, I consider myself a very lucky person because I was able to work. I had a wonderful job, although I had to give it up for 6 months because of my endometriosis and leave my coworkers in the lurch. And that was really hard because one of them suffered from chronic fatigue syndrome. And you have all those feelings that go with that. But I had a great career, albeit the last half of it, I had to work part-time because of all these things. But I've had the financial resources and amazing health care to seek out good doctors and the best surgeons. For the quality of health I have today, and I count it as good as it gets, I am grateful to them, and I'm mostly grateful to myself for taking care of myself. Chronic pain is a funny and fickle friend. It comes with a vengeance. It settles in and it drains you slowly over time. It can relinquish control just long enough that you have this illusion and hope and feeling, oh my gosh, I'm going to have a life without pain, as I have been fortunate enough to have 6 years before the beginning of this new year in that little void. It was so wonderful. And if you're able to focus and listen to it, it can help you figure out how to ease it sometimes. Just like your very best friend, though, the one thing it never does is go away. It's there with you forever. And so all of us with it continue. I continue. Many people I have known in my life do not know how much pain I've been in, either in fun times, work times, any time. And there are millions of others like me. I've taken a lot of time to reflect in the last few years of my life. And I have learned so much from the mistakes I made managing all of this. I now try to embrace the pain. It's my good buddy. I surrender to the moment. I never give up. I still seek cures. I still take care of myself. And most of all, I just be a lot more in the moments that I have. There really is no other choice, and it also feels awfully great sometimes. My sincere hope for this campaign is that the medical and insurance establishment in this country can find a way to learn from the experience and expertise of those with firsthand knowledge of these overlapping health issues. Fund the research needed to prevent or cure them once and for all. And explore, try out, and reimburse for a myriad of alternative treatment procedures that can give women and men much needed relief. Equity demands no less. Thank you all very much.